Okay, so we've got some different livers here on the bench. This first one is a relatively normal looking ewe liver. The side that we're looking at, if you were opening up your own sheep, that's the side that sits against the diaphragm. The underside of the liver's got all those big white veins, the bile ducts that you'll see, and often you'll see the gallbladder on that other side as well. But we've just got these ones laid out diaphragm side up. So that shape and colour and consistency of that liver, that's a normal liver. And we're just going to step through some progressions of worse and worse eczema damage as we go up this bench. So our next liver here, it's reasonably normal colour, but as we come around to the front of it here, you can see the front part of that liver there, near the blood on the bench. You can see how it's become white and scarred up. You can also see some more white stuff across to the left there. That white is the capsule of the liver, and all the liver tissue in there has been burned away by facial eczema, so all we can see there is the capsule that remains, and that paler colour up there towards the middle, that's scarred up liver tissue happening there as well. We come up to these next two on the bench. You can see this one here, even though the colour is relatively normal and it's still a nice big fat liver, the shape has changed compared to our first one. So in this liver, the lower parts of it have actually shrunk away with eczema, and that sort of division that you could see in the first one is gone. So that lower and front part of the liver has been burned away by eczema. Coming across here, we've got a liver where it's still got that division between the two lobes, the front lobe there sticking out to the right, and the main part of the liver at the base there. But again, up in the front of this liver, you can see this white scarring here where the liver tissue has been burned away by the facial eczema damage, and all you've got left there is white capsule of the liver. And then we come over to these last two beauties here. You can see that these livers are becoming greatly reduced in size. They're becoming more sort of circular. The end point of that is what's called a boxing glove liver, and this one is getting pretty close to that, where it's pale in colour because there's so much scarred liver tissue in there, and that capsule has a thickened appearance because there's less liver under the capsule, and you can see how shrunken up that liver is. And if we were to cut into it, you'd see that the liver tissue there is much paler and scarred.